I did my paper on Florence Nightingale. When you think of Florence Nightingale, what do you think of? Do you think of a nurse? Do you think of someone who took care of soldiers during the Crimean War in Turkey? I think of someone who cared immensely for environmental health. I think of the first female statistician and the person who helped design hospitals as they are today. Florence Nightingale had emotional intelligence beyond her age. She got whooping cough when she was about 9 years old, and she proceeded to take care of her 13 dolls because they now had whooping cough. She also helped keep stats on her family members that were sick at the age of 13, and she helped take care of animals. She understood that emotions were contagious. She would not put up with people being negative. She was very tough on the nurses that she taught. Back in her day, Florence wasn't able to get a college education. That wasn't heard of back then. Lucky for her, her father was a university graduate, and he taught her at home. He taught her math and other subjects. Lucky for her, he did that because she became immensely involved in math. She loved math. Her passion for statistics saved lives. Because of the data that she started collecting and the things that she enjoyed to do by collecting statistics, she ended up finding correlations between issues of why the soldiers were dying or why the death rate was so high. Her data records influenced the records that we have today. Everything she did back then, all of her charts, her pie graphs, everything today is still used. She was an innovator. The stats led to the determination to eradicate avoidable deaths. She wanted to make sure that when she went into those hospitals and saw that 80% of these soldiers were dying, that she would figure out why. It led her to fight for environmental health because when she went into the barracks, those soldiers had bloody, gross dressings on. They were laying in bedding that had never been washed, and their nutrition was horrible. They were smushed into little spots. They didn't have any light or ventilation. She started looking at the reasons why. Why are all these soldiers dying? Is it the environment? She loved to learn, and since she was so curious and wanting to find out why these soldiers were passing away, then that led to her studying all of those statistics and deciding that why don't we go ahead and wash the dirty linens and see how that helps. Give the soldiers more space, give them more ventilation, give them light. She commissioned to have rotting floors replaced and venting added into the hospitals. The architecture then for the hospitals that we know it today was from Florence Nightingale. So the venting, the lighting, you go into any hospital today, you're going to see windows, you're going to have nice fresh air going through, the linens are cleaned every day, the patient's blood-soaked bandages are cleaned every day. These are things from Florence Nightingale. When she decided to build hospitals or help design hospitals, she thought, well, why don't we have everything right there in one spot? So she added pharmacies, she added laundry, she added nutrition, infection control. We had libraries not only for the physicians, but also for the patients to pass time. She had a medical records area. She had epidemiology. Now, if you think about any hospital that you had to unfortunately go into it as a patient or you visited, what would that hospital be without all of those things right there under one roof? She brought that to us. She wasn't just a nurse who was helping soldiers a long time ago. She cared about environmental health. She brought statistics to this arena, and not just in healthcare. And she was designing these hospitals for future use. What an innovator. What an imagination. What a way to go for what you believed in. I would encourage you guys to check out the ANHE. It's the Alliance of Nurses for a Healthy Environment. Even if you're not nurses, because they show what the environment can do to our health. And they have a lot of coalitions trying to make sure that we get environmental health to take care of what's going on in our bodies and in our world, in the community. I also wanted to see if you guys wanted to do this glitter project. I did it with my Girl Scouts a few years ago, and I like to think of Florence Nightingale maybe doing this glitter project, because what we did is we put glitter on all the girls' hands, and we went around the room for about an hour just doing our usual craft stuff. You could do it in your own house or whatever if you want glitter all over your house. Because then afterwards, what we did was we found out where all the glitter or the germs were all over the house. I think Florence would have gotten a kick out of seeing how far all germs can spread. She was an innovator of our time, and I'm very proud to have studied her more, and I hope you guys take an interest in her. Thank you very much.